for discussion on the future of health, AI's role in revolutionizing care, hosted by Global Alliance on Sustainability and AI, GASAI. And I'm Helen Teplitskaia, the founder and president of GASAI, which I founded in March 2024. I'm absolutely delighted to be joined by such a distinguished panel and by my fellow co-moderator, the ethical AI guy, Testi. We will leave the floor to introduce the panelists themselves. The floor is yours. Tom?
Yes, I'm Tom Testi. I've been a software engineer for over 40 years. I've worked in all sorts of industries. Big part of mine was telecommunications. I started up a startup back in the early 90s and effectively have seen all the changes that have happened since the start of the personal computer. So I was happy when Helen invited me to join GASAI, and just loving doing these kind of webinars. So I'm going to let each of the panel introduce themselves. Let's start with Michael.
Matthew.
Oh,
yeah,
Matthew.
Michael's my brother, and Mark is my other brother, and Mary is my sister.
Excuse me on that
I'm
one.
Matthew. That's all right. So my name is Matthew Versaggi. I'm AI SME of about 4 decades. So I started about the mid 80s and been staying pretty tight with that all the way through. Classically trained in AI technology at the graduate computer science level. Worked in fusing in that healthcare space. Worked at the big Fortune 5 healthcare area, Optum and United Healthcare, the United Healthcare that's been in the news recently, handling their global center of excellence. So we've seen hundreds of healthcare use cases in that space. Branched out into the AI strategy space, business strategy space. We began fusing in the business side of that vis-a-vis the larger context of things we're seeing on a global scale. And now I'm what's called a Presidential Innovation Fellow from the Office of the White House, and I'm stationed at CMS. That commands upwards towards 20% of the nation's budget, CMS, and I'm involved in the group that pushes AI through all of that. Now, having said that, none of what I say, I am not representing my agency or any of that whatsoever. The views here expressed are solely my own, and so I need to make sure that that's well established. So passing along.
Okay, let's go, Harvey.
Well, first of all, thanks for having me. I'm an emergency room physician. I'm blessed in that I am really focused on 3 things. Number 1, I've been doing emergency medicine for about 20 years. Number 2, a bit of a serial entrepreneur. I had my own emergency rooms, hospital system. I grew basically freestanding ERs, hospitals, urgent cares, billing system, all of that. So I have a strong understanding of the C-suite in healthcare. And then the third, I have my own AI company. I wrote the first book on how to use ChatGPT in healthcare back in 2022. Since then, I'm an advisor for the country of Singapore, advisor for the Texas Medical Association. I consult different companies like Teladoc or NASA. I was in NASA a couple of weeks ago. And then just working on how can we use AI in healthcare. So honored to be here and excited to be here. So thanks.
All right, Phil.
Wow. Well, after those resumes, you'll be completely underwhelmed by mine. I'm currently serving as the Director of Customer Service and Workplace Technology at Children's National Hospital in Washington, D.C. And like Matthew said, all of my comments are reflective of my own position and have nothing to do with the organization I work for. But prior to this, I was the Chief Technology Officer at Luminous Health in Annapolis, Maryland, and then Chief Information Officer at Calvert Health in Southern Maryland. And then before that, I was an intelligence officer in the Navy, of all things. So I've I've seen a lot of uses of technology in various sort of environments and the ways that they've been applied. It's fascinating to see the rise of AI and how quickly it's happening. And I certainly think that there's a lot of work to do to make sure that we do it right.
Okay. I'm going to throw out, Sophia.
Yeah, last but not least, hi, I'm Dr. Sophia Ononye. I trained at the Yale School of Medicine in cancer biology, specifically triple-negative breast cancer research. And one of the things that I found from my time as a medicinal chemist is that AI has been around for a while. I know it's sort of the buzzword, but I think about Michael Knight, like Knight Rider. We've had like talking cars for decades. But I think there's just something about what's going on right now today, where we all, regardless of our backgrounds, are thinking about the applicability of AI to our work. So I did in silico drug design as a cancer researcher back in the day, not to age myself at all. And I got patents and trademarks and all that stuff from it. One of the things I really enjoyed about sort of my evolution in the past decade is sort of switching from that hardcore technical cancer research person to being more of a business person, the person that understands the business of medicine and the business of the life science industry and pharmaceutical companies and such. And I know sometimes in healthcare, business seems like such a bad word, but we are in the business of healthcare, and AI, probably ChatGPT and generative AI in the past maybe 3, 4, 5 years, that could be the most significant evolution, right? Because some of the fundamentals have been there, but how we apply it, how we use it has changed. And so what I've somewhat become is that person that is fusing, hardcore science with AI to help people, pharmaceutical companies, biotech companies, academia, better understand that interconnectivity. And the most significant thing that's happened to me in 2025, I know it's only been 30 days, is that I am now an adjunct professor of chemistry and biostatistics at a local university here in California, Concordia University, and AI still comes into play. And the last thing I will say before I stop talking is A, I was born in Nigeria, so I always have that sort of international perspective. And B, I have a master's degree in public health and an MBA in addition to my PhD in medicinal chemistry. So that interdisciplinary thinking, cross-functional thinking, which is what AI really helps us to do, is grounded in my foundation. And see, I like people. I like building relationships with people. And I think if you like people, you understand machines and you like science a little bit and you know how to engage, and you'll be called upon to give talks. So for example, during LA Tech Week back in October, I was invited to give 2 talks at the AI LA Tech Conference. I talked about value-based care and the impact of AI on that. I talked about personalized medicine and the impact of AI. I mean, I could go on, but you get the idea. And just last month, again in LA, I live in Irvine. I don't know why I keep going to LA, but that's a story for another day. I spoke at the LARTA conference, and it was really focused on sustainability. And the reason why I mentioned that is for my last sort of point. I have a podcast called Amplifying Scientific Innovation. I launched it during COVID-19 as a way to connect with people, bring some credibility at a time of significant fake news. And I've interviewed 65 guests so far in that time period. And the most special to me is named after me. Her name is Sophia the robot. Yay. So the first humanoid robot was one of my most recent guest. And we talked about a topic that I will sort of touch upon during our talk today, which is about sustainable, ethical, conscious use of AI. I think when we think about healthcare, ethics always goes into place. And I think it'll be interesting through our conversations today. This is a talk that I also gave for the Irvine Greater Chamber of Commerce about that interconnectivity between ethics, AI, and healthcare. So it's a pleasure to meet you all, and I look forward to building relationships.
Oh, thank you.
Before we go ahead with our discussion, I would like to very briefly, I promise, tell a few words about myself, because I think it's important to understand how we all can make a difference. My background actually started in librarianship. I was a librarian, and when I came to the US in 1990, I started as a faculty at the University of Illinois in Chicago. But prior to that, I went through an internship at the American Medical Association's Division of Health Information Management and Administration. It was 1990s, scary to think about it. So for over 8.5 years, I was a faculty at UIC, And one of the highlights of my career as a healthcare professional in IT sector, I integrated EBM, the evidence-based medicine, in the curriculum of medical schools, nursing, the hospital. So I left the profession in 1998 as a distinguished member of the American Academy of Health Information Professionals, because I really had to support my family, and my salary of $38,000 at the time could not help me educate my son and help the rest of the family members. So I graduated from Kellogg School of Management, Northwestern University, being simultaneously a professor of global markets and global initiatives in management at the Kellogg School of Management. So since then, I am integrating my business interests and experience developing business, I would say globally, with still remaining interest in healthcare. And one of the major drivers for me to found the Global Alliance on Sustainability and AI, I've been running my boutique consulting firm, Imnix Group, since 1991. I'm an entrepreneur, as all of you are. And I understand that there is nothing more important in our lives than health. We appreciate that sometimes too late. I'm a breast cancer survivor, and I have been able to help quite a few people with finding proper information and enhancing their own participation in treatment of their illnesses, and in some cases being predictive and proactive. And I want all of us today also to convey how important it is for each of us, not just as patients, but you healthcare professionals, to work together and collaborate. Also, as I came up today with the thought about the Trinity, the Holy Trinity of patients, healthcare professionals, and IT developers. So with this, please, Tom, start the program.
Okay, what I'm going to do is I'm going to ask a question, and whoever wants to raise their hand, so to speak, and jump in can do that. First one I've got is, what ethical frameworks should guide the development of AI in healthcare to ensure patient safety and privacy? Anyone?
Well, I think for me, it's not like a one size fits all approach, because when you think about frameworks, is it the rights approach, the common good approach, the fairness approach? Are we going to try and be utilitarian in terms of our approach? For me, it's just about that consciousness, the awareness of what we're doing, and making sure that we're not providing our patients or our customers or whomever our core constituency is with false information, right? So I think if they're going to, collect patient data, then you should tell them that data are being collected. If they're going to be shared, they need to be shared. And then the problem we have, of course, with AI is just like, everything is still in flux. GPDR rules, for example, if you're still here in California, there are different rules. There's a lack of standardization in terms of how we handle and manage data privacy for patients. I think that ideally is we want to see more transparency. We want to see more accountability. And regardless of what model or framework you're looking for, I think any approach that heightens the transparency, accountability would help to build that trust, because trust is always that hidden word that we don't often talk about, but it's such a critical aspect. Whether you're trying to adopt a new technology or you're trying to get buy-in from patients, how do you build that trust? And in my opinion, you can really only build trust by being transparent and also being accountable as healthcare providers.
Harvey, it looked like you were going to say something. Or
Yeah, I think Harvey was next in line. Yeah.
Okay.
Yeah, all I was going to add is definitely we need to make sure that we're being transparent with our patients. Number one thing, if you are using AI, that transparency is key. I know she alluded to it, but we got to make sure that when our data sets are training our certain AIs, that the practitioner understands the AI. Let me explain. If my data and my AI is concentrated in a certain part of medicine or population, let's just say population X, and I'm speaking to population Y, then my data is not reflecting of who I'm speaking to. So the practitioner needs to understand that. And so they need to be like we said, being able to explain how it is, make sure that it's fair to everyone there. Obviously, through HIPAA laws, or if you're out in Europe, the GDPR, we're going to make sure that these privacy laws are in place and that the startups are aware. I'm seeing a lot of startups out there toying with different ideas and trying to push it out to the healthcare systems, and they're not being careful with HIPAA laws, which is quite interesting. So anyway,
Right.
Next.
Okay, Matthew.
So I'm gonna chime in on the word ensure. I always have an issue with that because that gives you this connotation that you can guarantee, and there are no guarantees. You can mitigate risk, you can cope with it to an acceptable level,
Please
but
speak a
there's
little
no
louder,
way you can
Matthew.
ensure anything.
Just a little bit louder.
Oh, let me make sure my microphone is working the way it should. Bear with me. How about that? A little better?
Yeah.
Okay. So the issue I had was with the word ensure. Like, you can't ensure anything. You can't ensure security. You can't ensure, any of that stuff. We can mitigate risk and cope with it to an acceptable level, but ensuring anything is really the bad word to use because it's not possible. Really what we want to do is get it to an acceptable risk. Now, the other thing that's an issue here is most of you are coming at this through a lens of machine learning. Got to have data, train a machine to do something, and then deal with model drift and all the other things associated with that. But AI's got this evolutionary character to it because it's a general purpose technology. It evolves over time, and I've watched it evolve over 4 decades, and the evolution changes. So when we move into the agentic world, where you've got autonomous agents that can learn from their experiences, that changes the governance game. So how we govern what we have in front of us now to ensure the things that we need to ensure will change when the capabilities of AI change, and we need to expect that. So back to you.
Alrighty. Can you share specific examples where AI has successfully improved early detection of diseases like cancer, et cetera, and what are the implications for patient outcome?
So on the specific example side, when you're looking at concrete examples, so on the lung cancer detection side, you've got an AI model called Sybil that demonstrated remarkable ability in predicting lung cancer. In the breast cancer prediction, I believe there's one called MRI, M-I-R-A-I. I hope I got that right. There's predictive models in colon cancer and pancreatic cancer and prostate cancer and general cancer as well. The predictive models are doing really well. And so if you have, because of the nature of cancer, and Dr. Sophia can tell you that, the more runway room you have in detecting it, the better off that patient's going to be.
Yeah, and I was just going to add, obviously there's 2 flavors of AI. There's structured data and unstructured, but the skin is this. We're all used to hearing that the AI is reading an X-ray or a CAT scan and those kind of things. When I think of cancer prevention, those are pretty obvious. Example, if I'm a radiologist and I'm reading X-rays, CAT scan, I'm a human, I may miss a small detail, but the AI is being trained to looking for certain pathologies. Case in point, there's different studies out there. The one that comes to mind is lung cancer. As an ER doctor, when I see an X-ray and the radiologist says it's a benign nodule, come back in a year, do an X-ray, it's probably nothing. They've actually gone back and looked at all those X-rays, and now they can discern which ones are actually malignant and which ones are not. Again, that's through AI. And then going back to the ensure comment, from a political point of view, that does not what it means. I put the definition in the chat for everybody to go through.
So plugging back in on that early detection stage, when we begin to move to wearable AIs, and we move to this concept of the human body as a computational platform, where we can move from taking snapshots of folks with concernful comorbidities to 724 monitoring side of the house, where we can monitor these folks at great distance autonomously. That has one of the best chances to really kind of change how healthcare is delivered. So look for the idea that human body can be a computational platform. We can put sensors on the body, we can put sensors in the body, you can wear things like this or a ring, you can do the watches, you can do sensors all over the place. We do that with athletes all the time. So when that becomes more prevalent, then the ability to treat people, not just as snapshots, but as the long trajectory of capabilities becomes possible, and that will change the game.
I also want to bring up a point that we talked about just in terms of AI learning. AI is learning from us. One of the things I noticed when I was speaking with Sophia the robot is that she was asking me questions. And normally an interviewer is asking the question, but AI is learning from us as much as we are learning from AI. The challenge is, what are the data sets themselves, right? What do our data say? If we have data that are not representative of the demographics that we live in, then we're going to have limitations in terms of the efficacy and safety. So I've often talked about clinical trial diversity, even at a time where diversity is becoming somewhat of a dirty word. In this case, I'm talking about data heterogeneity, right? If we go, the more data heterogeneity that we have, then we can start to trust on the data, on whatever the results we're seeing, we can, believe, or to the best that we can. So part of the teaching a biostatistics class, talking about probability, because that's what we do in chemistry, in biology. What are the chances that you get cancer? How would AI help you to detect that? How could AI improve our accuracy in not just the detection of cancer, but also in the treatment of cancers, right? But not just cancer. What about Alzheimer's? What about, because I know so much of what we do, we tend to focus on cancer. I mean, my background is in cancer, so it's going to come up quite a lot. But AI has the ability to really challenge how we treat any type of disease. For me, probably a salient point that I don't think is emphasized quite enough, it's around how do we leverage AI to improve patient-physician, patient-provider communication, right? How do we leverage AI for digital trials, decentralized trials, remote trials? During COVID, we were talking a lot about decentralized trials. It's sort of, gone back to what it used to be, because that's life. But I do think, for me, it's not just about delivering healthcare. It's also changing how we communicate with patients, changing how we share information in real time. I imagine a future would be, we're going back to the doctor with a bag, right? The medicine bag. But this time around, the medicine bag is data. The data are powering our knowledge and how we engage. And so a patient could be like, oh gosh, my blood pressure just went up really high. And they can be able to communicate that to a physician in real time, whatever the case might be, whether it's in a clinical trial setting, it's an at-home setting, because we also have to think about real world data. How are we keeping track of that? We rely so much on clinical trials in the industry, right? But when a drug gets approved, it goes out to the whole population. So how do we keep track of all that data? And so there's going to be a point where I think people are always asking, how do AI affect my job? But I don't think we've even fully utilized AI to its capabilities. I think we're probably 40% in terms of efficiency, how we utilize AI, how we understand AI. There's a lot of growth, and there's a lot to do with AI, whether it's diagnostics or whether it's the process of delivering drugs, or whether it's how we communicate with our patients. I think the last point is one that probably doesn't get talked of enough.
Well, I think what you're alluding to is the change in culture. As a healthcare professional, you and I used to see one, do one, teach one. In the real world, we have VR, we have AR, we could practice intubations 1,000 times virtually. We can have digital twins to take care of things and help us be better physicians. But that culture is not ready. A lot of the people in power are not trained or understanding, but that's where you and I are coming in. We're educating, we're explaining, we're telling them how these tools are being used. And that will lead the way towards changing our healthcare system.
I think that part of ensuring that those that AI is able to actually be successful in predicting, various diagnoses and coming to a successful outcome also requires, sort of Sophia was mentioning, when you get out in the real world and you're collecting that data, oftentimes, you don't know the full outcome. So did the patient relapse? Did the patient pass away? Did the patient live a full life with no other issues? Those kinds of outcomes are really important to go back to teach the AI how to work. And so it becomes a real challenge to collect that data, because now you need to connect all kinds of data sources in order to do that. And now you're starting to talk about privacy and, that sort of thing. I changed doctors because I wasn't happy with my old doctor. Well, now you need to follow that patient to the new doctor, but is the old doctor going to find out? So there's a lot of these things that really become critical whenever you're trying to train AI to be effective in specific diagnoses.
Well, and then I would also add, you're limited to what the patient tells you. I mean, if, say, for example, they smoke, a half a pack of cigarettes, or if they tell you I've smoked a half a pack of cigarettes a day, but really they're smoking 2 packs a day, or they never drink, but yet they do, or, just quite a number of things I think would also affect that too. Okay, how is AI going to be utilized to develop personalized treatment plans, particularly in, say, oncology? What kind of challenges do we face in this area? I think you were, Sophia, I think you were alluding to that.
Yeah. I mean, you look at lung cancer, the classic example, because most of the patients that have lung cancer are usually in an advanced stage 3, stage 4, when they get diagnosed. And so if we can leverage data sets, how do we improve the detection? Because to me, early diagnosis, early detection, better prognosis, right? Because no matter how aggressive your treatments might be, we all know this naturally, right? If you catch a tumor early, then you have a better chance of treating that tumor. But to our point earlier, collectively, the way that we detect any disease is also indicative of cultural or systematic issues, right? So if you look at lung cancer, I did some work with AstraZeneca, and we were trying to build an early detection platform for lung cancer patients. And they're like, oh, where do we start? I'm like, well, have you looked at the data from the American Cancer Society in terms of the demographics for lung cancer? Did you know that many of the lung cancer patients happen to be Black males? Many of them happen to smoke Newport cigarettes, like the menthol cigarettes, and many of them happen to be located in the southern districts. There are specific areas where you can find them. In addition, there's a correlation between the early detection rate and socioeconomic status. So obviously, before we even talk about data analysis and all that stuff, fundamentally, do these patients even have access to care? And then you think about the iron triangle of healthcare, which is around cost, access, and quality. Something has to give. And if you want to improve access or quality, then probably you need to reduce the cost. So it's really, for me, it's a complicated puzzle that starts with understanding the patient journey and how dynamic the patient journey can be depending on your socioeconomic status, and then taking that knowledge to say, how can we improve the chances of patients actually going to the hospital for just their annual checkups or things of that nature. And then from there, is there a time where we collect enough data points where the system gets triggered and says, hey, based on the data point that we have, person XYZ is likely to have lung cancer. Let's bring them into the hospital sooner. I don't know if we're quite there yet. It's still mainly an input-output system. And because the input is still inefficient, the output is going to be fairly inefficient as well.
So one of the
So
strengths of
jumping in.
AI is the amount of data that it can handle. If you gave me your genetic genome, it's almost impossible for me to go through and match, okay, you have X gene, okay, this research just came out today. And so having an AI system, and these databases exist, where I have your genome, and say the New England Journal today publishes an article on X gene that puts you at a higher risk for, say, breast cancer, then now if you're in my database and I know that information, I can call you and say, hey, this study just came out, we need to screen you for XYZ because of Y. The other part of this is this was kind of talked on earlier, these systems are so strong that now I'm able to develop drugs quicker. Some studies show that the price of developing a drug can drop down to 90%. And what does that matter? Well, if I have a budget of, say, $200 million and it costs me $1 billion to create that drug, I'm not going to do it. And so my point is, as a physician, I'm looking at what diseases out there are possibly rare. What things can AI leverage now and now start treating, because now the price has gone down to such a point that now it makes, and this sounds horrible to say, but now it makes financial sense from the pharmaceutical point of view to put in the dollars to make that drug. So that takes us now to the next step, where if you have, let's just pretend it's diabetes, and I developed this medication that was specific for you, two things happen. Number one, your side effect profile goes down because now I'm not having to give you this big dose because I'm treating this big dose for the bell curve. And what if you're on one side of that bell curve, or maybe I don't have to give you this big dose. Maybe I need to give you a very minute, but that's the dose for you. And so AI is allowing us to do those two things.
So chiming in on the idea of, how is AI undergirding this personalized treatment plan space? It is actually doing quite a lot in there in terms of, precision diagnostics, optimizing the entire treatment plan. And it's doing quite a lot in terms of what all of our panelists have talked about in terms of integrating genomics, clinical, pathological, societal data to create individual plans. So that's the thing. But there are some challenges to it. This concept of mass personalization at scale is one of them. How do we do, and the retail area has been looking at this for quite a while. How do we have something that can create a really rich personal experience for people at scale? So that's an area that's being looked at now and is being worked on quite a bit. Other challenges that will help or move the needle, so to speak, is AI on the edge, sort of monitoring with wearables, things like that. When you're able to monitor someone 24/7 automatically, that does really change the game. But other challenges along that way, when you're talking about not IoT, but medical IoT, you've got medical devices all over the place, and you've got a clear path from the device to the individual to the automated decision support system, automated medical decision support system with a plethora of doctors. You've got security concerns all along these lines. And protocols are changing. Quantum computing has come into the play. That's could change the security protocols quite a bit. So all of these challenges do exist, but it's worth it. There's good upside to it.
Okay. Now, what role do strategic partnerships play in advancing AI technology in healthcare? Can you provide some examples of some successful collaborations?
Yeah, there are a few that just come right off the top of the head. I mean, Duke Health and SAS got together, did quite a lot of great work there. They put together a number of capabilities that would improve the healthcare delivery process. They had some really good work in digital twinning. Mayo Clinic and IBM Watson is famous, that everybody sort of talks about them. John Hopkins and Microsoft had quite the relationship for a while, and still does. Sutter Health and GE Healthcare also had one. And there's other notables like UC Davis Health and Amazon did quite a bit of good work. Providence, again, with Microsoft, they're all over the place. Northwestern and Dell, Northwestern Medical and Dell, and on and on and on. So there are some pretty solid examples of those kinds of industry partnerships.
I'll just throw some more. Google and for those that are in Europe and the NHS, John Hopkins AI Research Labs, IBM Watson's it's a good one because that was one that they had high things that they wanted to do. They wanted to take care of cancer patients, but unfortunately, as we all know, that did not work. I think they were ahead of their time, but it's a good case study to study about if you haven't looked into this space.
I also want to add NVIDIA. They've done a ton of collaborations with healthcare companies, and obviously that's sort of up and coming in terms of innovation and AI-powered solutions, so medical imaging, drug discovery. I remember they had something with Illumina, Genentech, GE Healthcare, Deloitte. So there's a lot of these sort of inter-industry collaborations. I also know they partnered with Yale University to get some publications out there, some of the first-in-class work. I think a great example of a healthcare company that has really prides itself on understanding AI and data is probably Moderna. In my opinion, it's probably the premier company when it comes to taking AI, taking mRNA technology, fusing it together. We saw that during COVID, and you see they continue to build collaborations. What's interesting about Moderna compared to even GSK or any of the other competitors is that instead of looking at building their scientific expertise, they feel like they're already strong science-wise. It's about how do we collaborate with AI companies to evaluate and take our science to the next level. And so they start out with, vaccines, mRNA vaccines, and it's like, oh yeah, infectious disease is one, but obviously oncology is going to be the bigger play. So definitely, another thing I also wanted to mention about IBM Watson Health is that they do a lot of generative AI work. I know they partnered with Moderna as well, and it's not just about drug discovery, is now also about how to use, ChatGPT, how to communicate with AI and to leverage that to improve communication internally between scientists, between groups. So I know we talk about AI almost as an output, but like I say, it's also the input and the output, how we're training our data sets, how we're feeding the information. And the reason why we're able to get a COVID-19 vaccine out so quickly was because Moderna has become good over the years in training their data sets and being able to say, okay, how do we apply this to this new modality or this new disease? But it's, training that data set, understanding the implications of the work that they're doing, and then partnering with the right people, whether it's, AI companies, obviously partnering with academia as well to get publications and such going.
I think there's another partnership to throw in here, and it's really a more fundamental one, and it's one that I'm very close to. I do believe that partnership, not competitorship, is the way to move forward in all this. But the first partnership that I think has to happen and has to be explicit, especially in ethical terms, is the partnership between the patient and the provider. So, the data is the patient's, and I think a lot of providers sort of, can sort of overlook that, unfortunately. So the first partnership that has to happen is to say, hey, patient, is it okay if we use your data? And then those two partners together can then partner with the companies to provide the data that the AI needs to be trained. But I think it's critical to ensure that the patient is part of the entire process. And it may be, obviously you're not going to go to each individual patient, but to sort of establish up front those guardrails about how the data is going to be used. Is it going to be de-identified? Is it going to be aggregated? And make sure the patient understands that and has an agreement with the provider about it, because that's going to be critical to ensuring that they're well represented.
I'd like to offer just two quick examples, and one of them is Stargate. There was a lot of talk, if you all remember, about this $500 billion partnership between the government, Oracle, NVIDIA, SoftBank, and some other, OpenAI and some other shareholders. But I remember Larry Ellison noting how this partnership will facilitate, for example, development of cancer vaccines, because now, at least they claim, they have the capability with this new empowerment to develop them within 48 hours, at least going forward, which is critical to improve the patient outcome, particularly when it comes to cancer and hopefully some other diseases. But I can't really stress enough how incredibly important the aspect that Phil Campbell just brought to our attention is the basic collaboration between the patient and the healthcare practices, because without quality data, there will be no quality AI. It will never become as reliable, because how will the models be trained? And there, despite all the efforts to desensitize, secure data, making sure that it's not traceable to a particular patient, still there are amazingly restrictive hurdles that prevent gigantic masses of the data to contribute. And it's particularly important for the equitable care, because if we are to meaningfully analyze data, we have to factor in all kinds of underserved communities, not just the ones that are very well researched. And that's where access to data is critical. And we're basically nowhere close to where we have to be. And that's where I would like to remind, if we come up with recommendations with something specific to address to Congress and the new administration, we can really make a big difference, a real difference.
That brings me to my next question, since we're being respectful on people's times and that. How will the new administration's focus shift for AI to provide increased organizational performance as opposed to overt concerns regarding risk, bias, and the equity change the landscape in AI healthcare? What is the root cause for the shift in focus?
Yeah, let me jump in on that because I have some pretty good visibility into that. So start with the big picture, and I think this is really important. So the fundamental issue is the shift that's occurring is from sort of overt risk avoidance to keeping responsibility as table stakes. Like if you're gonna do AI, do it responsibly. Don't be bring your A game, do it well. But it's going to move towards organizational performance. Like how does this AI, help the organization perform? The rationality for that is what's called a global technology arms race, which we're all in. And that's relatively common knowledge at this point in time. The ramifications of the winner of that on a global scale is a winner take all. So there's decades of geopolitical dominance at stake for the winner. And the shift in administration focus from that echoes that. And so that's going to be the root core of that. And so you're going to see really a three-tiered approach. It's like if you're going to do AI that makes your organizations perform better, however you define that, you do three things. Choose those use cases. So there's an identification of use cases that materially contribute to your organization doing better, however you define better or performing well. And then there's a speed component too. Get it into production as fast as humanly possible, but do it responsibly. Do it, make sure it's ethical, make sure it's secure, because security is going to be a big deal. But there's a performance at speed and scale, and doing responsible shift. And then as opposed to an overt concern about, don't do anything that's going to hurt anybody, don't do anything that's going to cause concern and slow down. You're going to see that quite the opposite of that, but you still have to maintain being responsible.
Anyone else want to chime in on that?
I cannot predict what the current administration is going to do, so I'll reserve my comments.
I don't know. Based on what Stargate and the $500 billion that they're proposing, I think they're looking at the basics of what we need as a country to advance AI.
It's 500 billion.
Oh, 500. Thanks. Sorry, 500. Yeah, 500 billion. Sorry, half a trillion. No, thank you. I appreciate it. The way I see it is, bottom line is, if you want these models to run, and you're looking at the infrastructure, if you can help increase the databases to run these algorithms, you're putting into the infrastructure. My analogy would be like building the highways that we built throughout America. We are building these data centers that are heavily intense energy suckers. And so if you can have that built in and create these algorithms where someone like me can use it on my phone or have that personalized care, they're talking about giving doctors an AI assistant to the point where if I'm inventing a drug or creating that drug that I was telling you, that I would have the compute power and I wouldn't be paying an arm and a leg. That to me is huge. Regardless of who the president and staying out of politics, I see it more as they're building the infrastructure, and that'll be positive.
Okay.
Correct. And as you go through that, remember AI morphs and changes.
No, I'm sorry.
So AI will morph and change. It will evolve into things that are completely different. And so to have the ability to fast track that innovation is extraordinarily important, especially when you are concerned about a global technology arms race and the sovereign state implications of it, on a global scale. So that's very important as well.
I was about to say that I am very optimistic about what this administration is going to do. There might be setbacks. There will be mistakes, but at least there will be significant progress. And it's up to us, the community, to make sure that there are guardrails. We need to provide feedback, and we need to fight to ensure that it is ethical and safe. But at the same time, we need to support it. We need to facilitate it, because we were talking about how AI is critical in early detection. And there are cases when without AI, for example, cancer will not be detected at all at a treatable phase. There is a recent example when a woman in UK who had her last covered mammogram by insurance, the radiologist missed, but AI found cancer. And if not for AI intervention, this woman would have been diagnosed at a very late stage. And there is data that actually AI is more precise than radiologists. I'm not advocating for AI taking over. AI is augmented. It is an additional instrument. We always have to rely on physicians. But at the same time, physicians are now empowered by AI, and precision medicine can provide much better outcomes than before. And going forward, hopefully it will become even better.
Well, I have a couple more questions I wanted to ask if anyone out there has a question for each other or for the panel or anything else.
Yeah, let me ask a question. I think healthcare has always been dependent on collaboration on an international basis. Does this drift us further away, or that collaboration exists?
I think even with the Kyoto Encyclopedia of Genes and Genomics, the KEGG database that I shared on the chat function, we're just seeing a lot of open AI where people are sharing data. I think the future is around data transparency, yes, understanding data privacy laws, and also sharing data. I think that's where we are. And we're a global world, and COVID-19 showed us that. And there's this sort of not in my backyard approach that we have, but a lot of our talk has been around cancers and such, but how do we prevent the next epidemic? Not talk about the next pandemic. How are we leveraging the data that are in front of us to improve our methodologies? We talked about how AI could also reduce, drug discovery costs, which in turn will help to reduce the price of drugs. So I think the future is really around collaboration, and we're seeing it with all the different collaborations that we talked about, inter-industry collaborations, technology companies, biotech companies, collaborations between big pharma and academia, collaborations between smaller biotechs. I think there's plenty of room for collaboration to strengthen our data and to leverage knowledge from the data to improve our healthcare.
Okay.
Maybe to throw a little bit on that, one of the reasons strategically, when you think about artificial intelligence, you have to think about it out as a general purpose technology, meaning things like electricity, like rubber, domesticated animals, steel, steam engine, things, imagine what the world was like before electricity. We all had candles, or before the steam engine. It's got unique characteristics to it, and it makes it quite powerful. It's ubiquitous across every organization, every country, everywhere. Like electricity is everywhere. So that's a good example. But it also evolves over time, and it has huge economic complementary. So if you split the atom over here, you've got nuclear medicine, nuclear bombs, and nuclear power. And those are powerful. Where collaboration comes in is that it's not the only general purpose technology maturing in the same window. You have biotech and nanotech maturing in that same window, that same period of time that AI is maturing in. And there's a fusion between those three. And that changes things significantly, because if it was just one at a time, there'd be a different story. But when you combine all three, then that whole scenario changes. The world has to talk to each other.
I mean, the challenge where I was going, Matthew, is you talked about the race. And in a race, the objective of any entity is to win and not to collaborate. Because if you're collaborating,
Correct.
You're essentially saying, I'm holding hands to cross the rope. And when that happens, then you can't win. So I fear, I differ in a sense that I think this is going to drive us towards sort of separation because.
So it's an interesting conundrum, because now you have a global Cold War, a global technology Cold War, and with all the same tremendous, all the same behaviors, And you've got the US on one hand, who, when we do technological advancements, like, yay, look what I did. I got a patent. Let me show you what I did. Let me show you how it works. Come on over here, have a look. On the other hand, in China, it's a black box. Like, you can't see a thing. And when you're talking about geopolitical struggles, one is intelligent and one is not. So on one hand, was the first side of that conversation and what we talked about. On the other hand is the reality of global competition. And that's life. That's what moves it from a science to an art.
Right. And that's what I was trying to point to, because I think the information sharing both ways is probably what's going to be successful. But as long as both sides are trustworthy and ethical and all the good stuff, because
Yeah.
that virtual care that we are drifting towards, it's going to be interesting paradigm. I guess following up on that, what would you say 2030, or maybe 2030 is too close, maybe 2035? What does success look like in AI and healthcare?
For me,
Um,
the
No, go ahead.
biggest, all right, I'll just say it real quick. The biggest success for me would be around drug discovery. If we can leverage AI to actually look at repurposed drugs that are approved before, find new purposes for it, speed up the drug discovery process, then we can drive down costs. If we drive down costs, then you improve access and then you potentially improve the quality of care. So for me, specifically, that would be a great way to measure impact.
So on my side of the fence, I would like to move away from drugs, right? I would like to move towards, so there's two sides of fraud. Let's use fraud as an example. There's fraud prevention and fraud cleanup. The losing side is on fraud cleanup. And the preventative side is the winning side. Prevent it from happening altogether. Same thing with healthcare, right? If you can focus on wellness and prevention in any way you can, then you don't need to go to all these expensive medical interventions because you keep people healthy to start. And that's success.
I love your viewpoint, by the way. I'm just slightly biased with all the semaglutides and that's going on. People still like their drugs, and no matter how much good advice we give them, you go to a doctor's office, you need a prescription for something. Unfortunately, that
Yes.
mindset change might take more than 10 years to evolve.
But it should of
Right.
changes a lot to.
And
But
and I'll just jump in by saying to the last point, rising tides will lift all boats. Even if there is this Cold War going on, case in point, it pushed China to produce a product. And did they leverage Meta AI? Did they leverage some of the chips that they quote unquote didn't have to have or weren't supposed to have? At the end of the day, they created it. Now it's pushing other developers harder to create a better product. And at the end of the day, I'm hoping that this helps all of us in a healthcare point of view. And to answer that second point, which is the question, I think we're, and I'm going to go with Matthew here. I would love to see, and I think we're going to get there closer to a proactive medicine instead of a reactive medicine, where the reactive, I needed to pop a pill, but if it's proactive and my AI product here on my phone is telling me, hey, dude, you didn't sleep last night. Hey, we caught it on your credit cards that you were buying McDonald's all week long. You might want to chill this week on the McDonald's and maybe get some extra sleep. Guess what? Now it's helping my longevity. One of the things I always do talk about AI is healthcare. I call it the healthcare IQ. The more I understand, the more I won't do things. Case in point, if I got a cigar right now and started smoking in front of you guys, you'd be like, what the hell is this doctor doing? But if I did that 50 years ago, you wouldn't even blink. You would think that's normal. So same thing, we're doing things today that we don't know. And what we don't know is what we don't know. But AI is going to help shed some light, put it in our wearables, and prevent us from doing things that we shouldn't.
I'm optimistic as well, but the challenge is we'll all have a virtual doctor to blame, even though he's going to tell us to eat vegetables and fruits. I doubt we're going to change behavior to start eating them. So
I disagree. If I have an AI model that is listening to you, seeing the way you grimace, changing your amplitude and talking to the voice that you like, putting you in the environment that you like, changing all of those things to the point where we're changing your behavior. I have an AI product, habit product, that will be coming out in about 3 weeks, that it's going to be using different leverages of AI to change your habit.
Yeah, I'm going to double down with Harvey on that side. I think that's important. And I think AI can do that. I mean, the medical interventions, medical adherence, and all that kind of stuff, the experiments we've done with AI on the edge intervening has been successful to an extent that makes us go, maybe that could work. And so, and you've got monitoring capabilities, you've got all kinds of new things that could happen. It could very well change that consumer behavior at scale.
I want to bring in the V. He has a question. Go ahead, Dave.
Yeah, thank you so much. So my question is basically revolved because Matthew brought a very interesting point in terms of different variables interacting, collecting data from different devices as well. So interoperability becomes an interesting part in healthcare in general, where different aspects or data exchanges happen. My question is that I was talking to one of the executives this month for like Novant Health, if you have heard about that. So one problem is that these organizations have been using CRMs like let's say health record management system like Epic most of the time, and most of the organizations using that. So integration is kind of hard in terms of, okay, how can we integrate such advanced technologies in terms of the existing systems that they're using, and a lot of healthcare hospitals and clinics have been using legacy systems as well. So you're an Epic hater, yes. Yeah, that's true. So and I've like looked at the Epic, and the interface is really bad. Even the patient side interface is bad. So that is a friction that we are facing as an IT vendor in terms of helping them to integrate these advanced solutions. So I just want to know your advice in terms of how you look at integrating in the existing systems of these cool technologies that are coming up.
So advice, no. Perspective, yes.
Yeah, perspective.
Right.
Okay.
And that perspective is, you don't have to look much further than what Microsoft used to do, right? When they were in their technology wars, they would do what's called embrace extend, which is fancy gaslighting for, we're going to take your protocols, add something to it that makes it completely uninterruptible with all of your tech stack, and good luck, buddy. And so, you get economic wars, and we are in an economic war. And by the way, that new AI model that just got dumped into the fray was totally an economic warfare move, because it obliterated millions and billions of dollars worth of investment, like in a moment. So you'll see these kinds of behavior patterns. That even though the spirit of the engagement is there and all the players are lining up, the next level of economic warfare is the technology side of the house. And that's where things get murky, because now we can play games. We can say, oh, we're going to do blah, 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 and give this nice fancy word that means nothing. But on the technological engineering side, the implementation side, we can have all kinds of play all kinds of games that won't allow our systems to talk together. And so what we need are standards, standards of interoperability that everyone adheres to the letter, that nations and standards committees can agree on, and that will help the problem. But make no bones about it, that level of warfare moves into the technological space very quickly, and there's lots of strategy there.
Okay, we're coming to the top of the hour. If anybody needs to go, they can go, and those who can stay, please stay.
I would like to say a few words, kind of as a takeaway. First of all, heartfelt thanks to all of you for this amazing discussion. I'll be honest with you, you all exceeded my expectations exponentially. We really had a fascinating discussion, and for patients and healthcare professionals alike, I hope it was at least equally interesting. And again, we're just starting. We just scratched the tip of the iceberg. There was no way we could cover everything in 1 hour, but we started this conversation, and I am asking all of you to please contribute your recommendations, your insights and thoughts for us to compile into meaningful recommendations to the new administration and Congress. Because there is really nothing more important than health. We are all in this together, and collaboration right now is at risk with all of the political biases and divisions of all kinds and all sorts. We need to play together, and this is the only way for us to survive. And it was funny how when the Cold War was mentioned, Alexa started answering a question which I didn't ask. It means we are constantly listened to. We do have adversaries, of course, but when it comes to survival, my own approach when I was teaching health information management was always preventive rather than curative. So AI already helps us with prevention, and being curative, of course, is essential, but it's much better when we can predict and prevent. So with this, I would like to thank you all for this amazing conversation. I can't thank you enough on behalf of the Global Alliance on Sustainability and AI, GASAI. Check our website and contribute your blogs, your articles, your recommendations. We are new, but we very much hope to have a real impact in development of AI for good. With this, thank you so very much, Tom, the panel. We'll see you soon.
And I would like to add to Helen's, maybe check in periodically over the, in the next year or so, just as these developments come along, or if there's some medical breakthrough, we'd like to get you all back.
Absolutely.
Yay!
Okay.
Take care, everyone.
Love you all.
Bye.
Thank you for
Bye-bye.
joining. Thank you. Bye-bye.
Bye now.